to COVID-19. This briefing is also streaming live on the Department of Health Services YouTube channel. Joining us today are Major General Paul Knapp, Wisconsin's Adjutant General, and Department of Health Services Deputy Secretary Julie Willems Van Dyke. They will be providing an update on the important work that continues to take place at the SEOC. After some brief opening remarks, we will open the line to questions from reporters in the order in which their RSVP was received. We will go first to Major General Paul Knapp, Wisconsin's Adjutant General.
Good afternoon, ladies and gentlemen. I'm Major General Paul Knapp, and I'm Wisconsin's Adjutant General. I'm here to update you on the role of Wisconsin National Guard and our State Emergency Operations Center as we continue to respond to COVID-19 efforts. One mission that we are taking part in today is augmenting polling sites in support of the 7th Congressional District elections. Due to a shortage of poll workers, the National Guard activated approximately 160 service members to state active duty to support this mission. These Guard members are serving in their home counties. They have been properly trained, just like any other poll worker, and will be wearing civilian clothing and will observe the physical distancing guidelines that have been established at each polling site. We appreciate the efforts of the Wisconsin Elections Commission and the volunteers we will be supporting today at the polling sites. The Wisconsin National Guard has also been heavily involved in COVID-19 specimen collection all over the state. We started with just 3 mobile test teams and have expanded this effort to 25 teams. Today we have 21 of the 25 teams currently on mission, supporting 16 different testing sites. To date, the National Guard has collected more than 17,000 specimens, which included an increase of more than 4,000 collected in the last 24 hours. By tomorrow, all 25 teams will be actively performing this mission all over the state of Wisconsin, involved in more than a dozen counties. I'm also very proud of the men and women of the Emergency Management Center and everyone across the state government working tirelessly behind the scenes at the State Emergency Operations Center. In closing, I want to encourage everyone to take a moment and look up to the skies this evening. Pilots from the 115th Fighter Wing will be conducting flyovers of more than 20 healthcare facilities across the state. In addition, the 128th Air Refueling Wing, based in Milwaukee, will perform an in-flight refueling mission in support of this exciting statewide event. The purpose is to honor Wisconsin's healthcare professionals and first responders. The flyovers are being accomplished as part of a regular training and proficiency mission, which are required for pilots to maintain currency and remain up to date on qualifications. The flyovers will begin around 5:45 p.m. tonight, and the schedule, which outlines the times and locations, have been communicated on the Wisconsin National Guard and the 115th Fighter Wing websites and social media pages. Again, I appreciate your time, and I want to thank you for your support of the Wisconsin National Guard and the State Emergency Operations Center.
Thank you, General. We will now hear remarks from DHS Deputy Secretary Julie Willems Van Dyke.
Good afternoon, and thank you for joining us today. An integral part of our Badger Bounce Back plan is increasing our testing, which the General has already spoken about. So I want to take a little time today to walk you through what getting a COVID-19 test can look like. First of all, you show your ID to get a test, and if you are experiencing any symptoms of COVID-19, or if you have been exposed to COVID-19, you'll be asked about those elements. As a reminder, the symptoms of COVID-19 are a fever of over 100.4 degrees, cough, shortness of breath or difficulty breathing, a sore throat, headache, chills, muscle aches, and a new loss of taste or smell. If you are experiencing even one of these symptoms, please get a test. Or if you know you've been in contact with someone who has tested positive for COVID-19, please get a test. No matter where you live in the state, your next step can be to call your healthcare provider and ask for a test. Explain your symptoms or exposure and ask to be tested. DHS is also partnering with the Wisconsin National Guard, as we've heard, to stand up community-wide testing sites in areas that have extensive community spread and areas that have very low testing. So at these locations, or to find about these locations, please visit our website at dhs.wisconsin.gov/testing. You will find a map of Wisconsin with each site listed, along with dates and hours of operation. Remember, if you do not live in one of these communities, you can still access a test by calling your healthcare provider. When you get tested, the nurse or possibly a citizen soldier, if you're at a National Guard community site, will take a nasal swab. It's not comfortable, but it's an accurate way to get the material our labs need to run the COVID-19 test. Test results take a few days. If you had a test because you have symptoms, it is important to stay home and remain isolated while you wait for the results. We understand that waiting to hear about your results can be a stressful time. Please remember to take care of yourself, to practice self-care while you're also practicing physical distancing, stay connected with family and friends virtually, and know it's okay to ask for help. Your healthcare provider will call you with the results. If you test negative, remember that you still need to practice physical distancing and staying safer at home. If you test positive, then your healthcare provider will talk with you about continuing to self-isolate and what steps you can take to make sure your family is as safe as possible. Soon after, you will receive a call from a contact tracer, a public health professional from your local or state health department. When a contact tracer calls, they will ask you questions about your symptoms, when they started, places you have been, and interactions with other people. It's not about getting you in trouble, and they are not allowed to share your personal information with anyone else. The reason they are asking these questions is to help protect the health of your friends and neighbors, to make sure that people who may have been exposed to COVID-19 can take precautions and get tested themselves. Picking up the phone and answering those questions can help keep your community safe. We know a positive test can be scary, and again, we encourage you to practice good self-care. And if your symptoms worsen, please follow up with your healthcare provider. Thank you, Wisconsin, for doing the work of staying safer at home, of physical distancing, of getting tested, and answering the phone when a contact tracer calls.
Thank you. At this time, we will open the line to questions. Reporters will be called on in the order in which their RSVP was received. In the interest of time, we will be taking one question per outlet. All lines are currently in listen-only mode. Once called on, reporters should dial *6 to unmute their lines. Once you have asked your question, we please ask that you remute your line using *6 again. We will begin with Addie Bink from WFRV.
Hi, thanks for taking my question. I was just wondering if you'd be able to outline how many National Guard teams are activated right now, conducting testing, and how many are just kind of waiting to be assigned to any location throughout the state. Thank you.
Hi, Eddie. Thanks for the question. So right now we have approximately 1,200 National Guard soldiers and airmen on federal Title 32 orders in response to COVID-19, and approximately 650 of those are directly supporting the testing efforts. And when I said that we have 21 of the 25 teams out today, we actually have all 25 teams are trained and ready to go, but there is a process we call ADVON. It's an advanced team that goes out to the sites in the days leading up to doing testing at a particular site. And those ADVON teams then look at the site, they talk to the local emergency manager and public health officers and coordinate the efforts for that test to start. So today we have 21 teams in action, 4 teams are doing other activities related to starting testing, and then in fact tomorrow we'll have all 25 out on the road.
Thank you. We'll go next to Ryan Curry with NBC 26.
Yes. If individuals, say, had symptoms long ago, but they've since recovered, they have been safer at homes, limiting their public exposure to essential trips to groceries and whatever, and currently have no symptoms, is it logical for them to go and get tested? And do you anticipate we'll eventually be offering mass antibody testing?
Yeah. Thanks for that question, Ryan. The situation you described seems like that person would be very low risk, and so they would not necessarily need to go be tested at this point in time. The tests we are doing at the community sites are tests for the virus, for the active virus, and so that situation sounds like someone, no symptoms, has been home, minimal exposure, no need to test. In terms of antibody testing, there are uses for antibody testing. One of the ways we can use antibody testing at this point in time is to do what we call surveillance across the state. If we did samplings across our state and looked for antibodies, it would give us a good sense of what percentage of the population may have was exposed to and had COVID-19, because we know many people have either no symptoms or very mild symptoms of the disease. The other reason antibody testing may be useful is to help an individual understand if they had disease. But I want to caution people about that at this point in time. The antibody tests do not necessarily mean you will have immunity for the rest of your life. Remember, this is a new virus and we're learning about it, and we don't know enough yet. So it doesn't necessarily mean you'll have immunity for your whole life. It doesn't tell us how long your immunity would last. And we also don't know at what level of immunity you need to have in order to prevent infection if you were exposed again. So I use some caution with thinking about antibody testing for individuals because you can't consider it protective, but it is an excellent tool for us to use to understand how prevalent COVID-19 might have been in our state.
Thank you. We'll go next to Danny Maxwell with WKOW-TV.
Hi, my question is about, we did another turning of the dial, as Governor Evers said today, with some retail businesses able to open today. With this kind of gradual reopening, more testing, are you expecting, more COVID positive tests? I would imagine you might be. But is there kind of a threshold that we would reach or anything that you're looking at that would make us have to turn the dial back down again or kind of reverse some of this opening of the economy?
Well, we are going to continue to monitor the incidence of COVID from now until we have a vaccine. That is the reality that we are at. We are increasing testing for the very reasons we have both discussed here today, in that it is important for us to know what is the prevalence of COVID-19 in our state. Up until the last few weeks, we've had very, relatively small levels of testing in our state. A few weeks ago, we were only doing a couple of thousand tests a day. I'm really happy to say now we are regularly doing 4,000 or 5,000 tests a day, and our goal is to regularly conduct 12,000 tests a day. That's a really important strategy for us to use to have this increased testing so that we know we can detect an outbreak if it's beginning to happen. And that will be really critical as we move forward. And we will have to make decisions. If we see outbreaks in certain communities, we may very much work with local health officials in those communities and say, hey, everyone, we need to dial it back. Everybody stay home more to prevent further transmission, because the same risk will occur if COVID starts transmitting in communities like it did early in this epidemic, that we could overwhelm our hospitals. So this is something we'll have to keep our finger on the pulse of as we move forward. And just a word about the opening up of retail. The reason that we made that change in our turning the dial is because this is a fairly low-risk activity. We're not talking about large numbers of people being together. As you know, the order says only 5 people in a retail establishment. This is, with that number of customers in a retail establishment, it is much easier for the owners and the employees to do the kind of physical distancing, to do the kind of cleaning of surfaces that people may touch, and to take proper precautions to reduce the risk of transmission between people. So it's this balance between how we all want to get back to normal life and how we do it safely. And that's what that dial turning was about.
Thank you. We'll next go to Bill Leaders with the Progressive. As a reminder, *6 to unmute your line. All right, we'll move on to Casey Nelson with WTAQ. Casey, *6 to unmute.
Hi, this is Casey. My question is kind of regarding something that Brown County officials said. They're saying that the National Guard isn't testing anyone under the age of 5, and I know there haven't been many cases of people, of kids with the virus, but maybe why is the National Guard not testing people that young, and is there any concern that younger children are contracting or spreading the virus?
I think I'm going to pass that one over to the Deputy Secretary in terms of the age that we want to test.
So the reason the National Guard is not testing children under 5 is because of the technique, and that's a pediatric test with children with much smaller anatomy and better conducted by their pediatrician. And so that's why we have an age limit on that. In terms of can children contract the disease and spread it? Yes, they can. In terms of where we, to date, have seen the virus, we've seen it much more in older populations. And so that would be another reason not to subject youngest children to the trauma of testing in their car seat or in their car. So this would, we are testing populations that are certainly more likely to have the disease, and we've seen it much more prevalently in adults. And so that's the focus of our testing.
Thank you. We'll go next to Gwen Gunther with the Wheeler Report.
General Knapp, can you explain where the funding is coming from, whether it's federal funding, CARES Act funding, or state budgeting for the deployment of the National Guard as well as the full-time functioning of the SEOC? And how long before you expend your budget and need to ask for additional funds?
Okay, that's a great question. Funding. It's an extremely complicated answer. So there are, as you mentioned, there's federal funding, there's state funding, there's CARES Act funding. So the one thing that I do want to say is that the 1,217 soldiers and airmen that we have on Title 32 orders, that is 100% funded by the federal government. Now those soldiers and airmen still stay under the direct control of Governor Evers as the Commander-in-Chief. However, that is 100% federally funded. We are also using or applying to use CARES Act funding for many of the operations, increased operations for the SEOC and for other functions. And then at the very end, when we go back and balance all of the books and put in all of our requests to FEMA, which is an entirely another complicated process, then there may be a small portion of what they call cost share that will remain with the state.
Thank you. We'll go next to Sean Kirkby with Wisconsin Health News.
And then at the very end, when we go back,
As a reminder, after you ask your question,
thank you for taking my question.
Sean, go ahead.
Thank you. I was wondering, I see some concerns about Racine County seeing a spike in COVID cases. Is the state planning any action to support that county? Thank you.
Sure. We have already had some testing sites in western Racine County. The process by which these community testing sites come to be is that local officials make a request here through the State Emergency Operations Center, and then we meet with them and act upon those requests. And so I believe my understanding is that the City of Racine made a request this morning, and that that request will be evaluated and move forward. Anything else you would say?
Yes, we actually do have a team out today at the Burlington High School in Racine County, and then also in the request that the Deputy Secretary mentioned, we're planning to follow on that testing series with tests in Racine, at the community-based test in Racine as well.
Thank you. We'll go next to Ryan Lobenstein with NBC 15.
Hi, this is Tajma in Ryan's place. My question is about contact tracers. I know the department is in the process of hiring more. How important is this as we continue to increase testing and even get towards reopening to have enough contact tracers?
I can only say it's incredibly important that we have this resource available. Testing without tracing is ineffective. And so the whole point of testing is, number one, as we said, to know where the disease is in our state, but then secondly, to know who has it, so that, as I mentioned in my opening remarks, we can have contact tracers contact the person who has a positive test and remind them why it's so important for them to stay home and isolated while they have symptoms of the disease so that they are not spreading it to others. And we also need to be in touch with them really quickly so that we can find out who they've been in contact with, so we can ask them to quarantine until they've been through the incubation period of this disease, which is 14 days. Right now, because of Safer at Home, most people don't have that many contacts. So when we call them, it's primarily their household members. But we know as we do start to open up the state, people do start returning to work sites, as they start to go out more and perhaps visit family members. Hopefully not go out into big mass gatherings, because we will not be recommending that anytime soon. But we do know people have more contacts as we start to open up. And so this process is really incredibly important to contain the virus. We also really need the cooperation of people across the state, that when a contact tracer calls them and says, you've been exposed to someone with COVID-19 on this date and you need to stay home and isolated until this date, that people do the very best that they can to do that. We also need employers to understand this, that people aren't just going to be making this stuff up to get out of work, but that this is really critical in order for us to control the spread of the disease and not end up back in a place where we have to shelter in place again as we have. So these are all really important reasons why we need to do contact tracing. And one last thing I would say is this is clearly a partnership between local health departments and the state health department. Typically, contact tracing is always done at the local level, and the state is here to help supplement those local levels of contact tracing, those local resources, those people who know their community best. When we see surges in the number of cases, when we have big testing events like we're having these last few days in Milwaukee and Madison, and there may be enough cases identified that go beyond the capacity of the local health departments, that's where the state contact tracers will come into play to assist our local partners.
Thank you. We'll go next to Jeremy Janine with Urban Milwaukee.
Testing capacity at the various sites. The original estimate for the 2 Milwaukee sites was 500 specimens per day. It sounds like nearly double that was collected yesterday. What actually is the capacity? What limits it? How can it be increased?
Okay, I think if I heard that right, we're asking what is the capacity in Milwaukee and how much can we increase it? Was that the
How
question?
can it be increased?
Okay, so both of the Milwaukee sites yesterday, we were hoping, based on previous experience, that we would get around 500 specimens. Well, each of the sites yesterday one of them did 965 and one did 954. So we were ready for that large influx of demand. And so what we had done is we put 2 test teams at each location, and then we had a backup team ready to surge onto the scene in case we needed additional support. And we ended up doing that shortly after lunch yesterday, and so we were able to ramp up the throughput by adding extra lanes. And so we'll have today in the southern site at UMOS, we had 3 full teams with the number of lanes that we had set up yesterday. And then in the north site, we actually moved a few blocks away to a larger parking area and added a 4th team. So there are some shifts involved because that site is open from 8 a.m. To 8 p.m. So it's a little bit longer than the normal day, but we're anticipating about the same type of turnout today. So really, it's a matter of adding teams and adding additional lanes in order to ramp up throughput. And our goal is to make sure that people spend a reasonable amount of time in line. We don't want people to wait too long, but then I also hope that people understand that when we're testing that many people in a drive-through setting, that we're doing the best that we can to get everyone in as quickly as possible. And I do have to say that this morning I had a chance to go out to the Alliant Energy Center and look at the testing efforts going on here in Madison and for Dane County and the surrounding areas, and it was going very well. It's a really smooth process. There were no traffic backups. I do have to say that the wait was about an hour, and the few people that I talked to exiting the site and kind of asked how they thought it was going were really impressed with the process, and actually were pleasantly surprised that the wait was only an hour because they are anticipating significantly longer wait times.
We'll go next to Shemaine Mills with Wisconsin Public Radio.
Thanks. One clarification and question, if I may. I came in late, so I wasn't sure I heard the number of free community testing sites there are around the state, and also how close or far away are we from the state's goal of 85,000 tests a week?
Okay, so test sites in terms of the National Guard test sites. I did mention early on that we have 16 separate locations set up today, and some of those locations, as I just mentioned, have multiple teams involved. In terms of the daily testing and testing capacity, in order to get to our 85,000, it's about 12,500 per day. And to give you an idea of just the National Guard teams yesterday did about 4,500 tests. I'm not sure what the rest of the state did yesterday in terms of their numbers.
I don't know because it's delayed by a couple of days.
Gotcha. Okay, so we're ramping up quickly, and we were really excited yesterday across just the Guard teams to have such a large number, and we're on our way toward reaching that goal of 85,000 tests per week.
How soon?
That's hard to answer, Shemaine. It's going to depend on a couple of things. It's going to depend on continued uptake at community sites as the testing the testing plan outlined. We are gearing up to test at all of the long-term care facilities in the state, at skilled nursing homes. So that will add to our total. We're working with healthcare providers to ramp up their testing as well. And we're also testing at outbreaks across the state. Whenever we know we have a flare-up, we want to get out there, test people, make sure people are appropriately isolating and quarantined so it doesn't spread further. The earlier we can come out, if there's a cluster of cases in a work site or a nursing home or another facility, the better. And so we're all pulling together in the same direction to make this happen. But, you know, as I said earlier, a few weeks ago, we were doing on average 1,500 to 2,000 tests per day. We are now averaging closer to 4,500, 5,000, and I know with this great work of the Guard, I'm anticipating in the next few days seeing daily totals in the 6,000, maybe even getting to the 7,000. So slowly but surely, we will get there.
Thank you.
Thank you. In the interest of, we had a technical difficulty. We're going to try to go back to Bill Leaders with the progressive again. Bill, as a reminder, *6 to unmute your line.
Hi.
We hear you, Bill.
Hello. I have a question regarding the tracing of cases to the protest at the state capitol on April 24th. On Friday, Secretary-designate Palm said that contact tracers were asking people who tested positive whether you came to the protest or went to another large gathering. This is different from what spokesperson Jennifer Miller has said, which is that contact tracers ask about large gatherings, quote, but not specifically about protest. So there's really no data on who may have contracted COVID-19 at a protest. Which is it? Are patients being asked whether they attended the rally? And if so, can you tell us how many answered yes? Or was that question not asked? Which case can you explain why it was not?
So it is a standard part of contact tracing to ask about attending mass gatherings and if the person has been at any event with many people. We ask the question that way in a generic form because we want to capture a wide variety of opportunities where people might come together because that is the risk factor. Many people in a smaller space or in close proximity to each other. We do not ask about specific events. People sometimes may, we ask if they've been in a mass gathering. If so, we ask where, and people may give more specific information. So it's, have you been in a mass gathering? And then tell us a little bit more about it in the interest of letting other people know there may have been an exposure at that particular slot. So that is how the contact tracing interviews happen.
Thank you. We'll go next to Bob Hay with Wisconsin Radio Network.
Thanks for holding the call today. Regarding larger retailers, could you explain briefly what sorts of precautions they would need to take in order to eventually open up? Would it be similar to what's being deployed by grocery stores around the state?
Yes, the Safer at Home orders have actually included some of the guidance that we would like to see in retailers, and also the Wisconsin Economic Development Corporation has recently released guidance for a variety of businesses that are opening that goes into a great amount of detail about ways that businesses such as larger retailers can open more safely. But if you think about it, it really revolves around a couple of principles. One is keeping people physically distanced. So that has to do with both how many people are in a store or a space at the same time. It's about how they flow through that space. And so how can we, for example, create one-way pathways through the store so we're not coming face to face with each other, which increases risk of spread. It's also about how, because the virus can be spread on hard surfaces, If we cough or sneeze and a respiratory droplet falls there and then somebody touches it and then touches their face, how are we handling cleaning of those commonly touched surfaces like counters, checkout lanes, machines for payment? So cleaning of commonly touched surfaces. And then finally, what are we each doing personally to protect from each other? Again, to reduce the release of respiratory droplets into the air where others may breathe them. And so things like employees of the store wearing face masks and patrons of the store wearing face masks. We know they are most effective when both parties are wearing a face mask. So those are some of the guidance. And I know the Wisconsin Economic Development Corporation guidance goes into a great amount of exquisite detail about how businesses such as large retailers can create a safer shopping experience for people.
Thank you. We'll go next to Mason Dowling with WAOW. Mason, as a reminder, *6 to unmute your line. All right. We'll move on to Riley Vetterkind with the Wisconsin State Journal.
My call. Just to follow up actually to Bob Hagg's question, I'm wondering regarding face masks, is it the DHS guidance or would you advocate for stores that are opening up as well as the larger retailers that are already open? Should they be requiring face masks? Is that most effective to prevent the virus? Thanks.
Well, we will leave that to each individual business to make that decision for themselves. Our public health counsel about what makes it safer is that it is what I just said. It is safer if both parties are wearing a face mask, because it is both, when you wear a face mask, you are preventing spread of your own respiratory secretions to other people. And if the party across from you is also wearing one, you are both preventing your spread of secretions and putting a barrier in place against others. So if we all want to do our part to reduce the risk of transmission when we are out in public, encountering people that we don't encounter in our normal daily life, it is safest if we all use a facial covering when we're out in public.
Thank you. We'll go next to Todd Richmond with the Associated Press.
No questions.
Thank you, Todd. We'll go next to Stephanie Hoff with WIS Business.
Good afternoon, and thank you so much for having this call. My question is for General Knapp. What exactly are Wisconsin National Guard's duties for today's election in the 7th Congressional District?
Hi, Stephanie. The Wisconsin National Guard, in support of the 7th District elections, are fulfilling a number of roles, all the way from poll worker to general helper to cleanup to assisting with sanitizing. So anything really that those local clerks want them to do. So they were brought on to state active duty, they all received training as poll workers and are working in their home counties, so that if those clerks wanted them to be actual poll workers, they would be qualified. But when they get there, they're kind of like all other volunteers at a polling site, as your neighbors out there in the counties, and they're doing basically whatever the clerk needs them to do to make the election successful.
Thank you. We'll go next to Stephanie Fryer with WISC TV. As a reminder, *6 to unmute your line, Stephanie. We'll move on to Adam Rogan with the Journal-Times.
Hi guys, thanks for taking the call. My question is, how is this was kind of touched on earlier, but when it comes to testing sites that are at specific locations, such as a jail or a long-term care facility or a meatpacking plant or some other business, how is it decided which sites are tested by the Guard or not tested? Such, like for example, the meatpacking plants, were they called in by DHS? Were they called in by the local health department? Was it the companies themselves? How did that decision get made?
So I can take the first crack at that. So the way that happens is all of these testing sites are requested by the local public health officers and emergency managers and the local authorities based on their need. And so one of the things we do when a request comes in for either a community-based testing site or other type of an outbreak site like you mentioned, then we ask them in the local area what are their capabilities and what are their requests. And they put in what's called a request for assistance. And so in that request, they would ask for specifically what they wanted in order to support that testing, such as like test kits. Some of the requests that have come into the State Emergency Operations Center for things like nursing homes or long-term care facilities already have a medical staff that are capable of administering those tests. And so in that case, they may just need the testing supplies, or they may need some additional PPE, or whatever it is that they need. That's what we try and fulfill at the SEOC. So, and in some cases, if it's very large, or it's specifically requesting a community-based testing site, then many times it comes to the National Guard to fulfill that. But there are also a lot of the healthcare systems around the state are talking about setting up their own community-based testing sites as well. So that's something you probably will see in the future in addition.
As a reminder to all reporters on the call, please mute your lines. Someone's typing and it's being picked up.
Do you want to add anything?
Oh, sorry. No, I think the General did a very good response to that question about outbreaks. And I would just add, we encourage people to conduct testing on their own. 25 Guard teams might sound like a lot, but when we think about the need across our state, that's why I mentioned earlier that there are many other parties that are part of testing. And so, again, for example, in a workplace outbreak, many employers have an active occupational health section as part of their business, and this is very appropriate work for them to do. So we are not saying that all testing needs to be done by National Guard teams or by public health agencies. This needs to be baked into every activity across our state.
Thank you. We'll go next to Chuck Kornbach with WUWM.
Good afternoon. A couple of questions about nursing homes.
One question,
the DHS said it was going to be releasing some data this week. Has that been put out? Do you have any comment on it? And also, can you describe a little bit more the situation about getting tests to all nursing home residents? Is there a delay with working with counties?
Yeah, nursing homes are a top priority in our testing strategy, and it is because our most vulnerable citizens live in a congregate setting in a nursing home. And there's two things we know about this virus. It spreads very quickly when people are living in congregate settings closely together, like a nursing home or a dormitory, and it attacks people who are of older age. And so it's double trouble in a nursing home. We are doing outreach to nursing homes throughout the state, and we are working through the process that General Knapp just discussed. Who has the capacity to conduct testing of their staff and their residents on their own? Who might need additional assistance with that? If so, what kind of assistance is that? Do they need test kits? Do they need supplies? Do they need personal protective equipment? Or do they need assistance with someone from the outside actually coming out and administering the tests? In regard to the listing of names of nursing homes with active outbreaks, that data will be going up on the DHS website this week, I believe tomorrow. And I want to make something very clear about these data. The reason we are posting these data is because we are at unprecedented times where family members do not have the ability to go in and see their loved one in a nursing home for their own protection. And so we are working to increase transparency of where there may be disease. In most cases, family members are going to already know this because the nursing home has already contacted them. Our nursing homes across the state have stepped up in this pandemic. They have taken the recommendations that both the federal government and state government have made to them to protect their residents. They have increased testing. They have created isolation facilities, and they have responded. So this is an opportunity to increase transparency for the family and friends of loved ones who live in those facilities, and it will include those facilities with active outbreaks. And once the outbreak is resolved, the nursing home's name will be removed from the list.
Thank you. Our last question today comes from Mary Spacuzza with the Milwaukee Journal-Sentinel.
Hi, thanks for doing this call. Do you have updated numbers about the testing that's been conducted at Echo Lake? I know there's been concerns about an outbreak there in terms of how many people have been tested and how many have tested positive.
I'm not familiar.
No.
Mary, we
We
can
actually
follow
don't.
up with that information and see if it's available offline. It doesn't look like we may have the information available right this moment.
Yeah, I don't have them on my schedule right now, but we'll take a look and see if there have been requests, because that would be the next thing we can look at is requests for assistance. And so we'll go back and look and see if there's been a request for assistance and update you offline on the progress of that.
Okay. Could you also confirm the numbers at the 2 Milwaukee testing sites? I just want to make sure I have them right.
Sure. I'd love to. I'm pretty jazzed about those results. Okay, so that is 954 yesterday at UMOS in the southern site and 965 at Midtown. And so again, both of those sites are 8 a.m. to 8 p.m. Yesterday we did 341 in Dane County, and I'm expecting that number to go up significantly today by at least a few hundred based on what I saw out there today.
That will conclude today's media briefing. As a reminder, you can always access the latest updates on the state's response to COVID-19 by going to the Department of Health Services website. You can also find additional information about the state's response through the websites of the Wisconsin National Guard and Wisconsin Emergency Management. Thank you for joining us today and for your questions.